Good afternoon, guys. Now let's take two on discussion A personality changes in midlife due to dementia or brain changes. Okay, here we go with today's presentation A. The article reports that certain personality changes in midlife can precede a later diagnosis of dementia, drawing on clinical experience and a large study of several of civil servants. It frames these shifts as early warning signs rather than immediate proof of disease. Key evidence and examples from the page. A psychiatrist, Professor Gil Livingston, describes cases where family members noticed a clear personality change years before a dementia diagnosis. One illustrative case, a conventionally behaved woman became more outgoing and distant from her husband and was later diagnosed with frontal temporal dementia. The article cites a new paper based on a major study, the Whitehall Civil Servant Cohort, that identified a set of midlife personality changes associated with higher dementia risk years later. What the phrase personality changes that are warning signs of dementia means here. Personality change refers to a sustained shift in typical behavior, interest, social patterns, or emotional responses compared with a person's long-standing baseline. Warning sign means these changes can appear well before cognitive symptoms become obvious and may signal increased long-term risk, not that dementia is already present. Why clinicians and researchers care. Early subtle behavioral shifts can provide a window for monitoring and early assessment because some dementia types, for example, frontal temporal variants, often begin with behavioral or personality changes rather than memory loss. Large longitudinal studies like the Whitehall cohort help link midlife patterns to later outcomes, strengthening the evidence that these changes are meaningful at a population level. Practical implications and appropriate next steps. If you or a family member notice a sustained and unexplained change in personality or behavior, consider documenting specific examples. What changed, when, and how it differs from usual. Recommended seeing a qualified healthcare professional for evaluation. They can assess whether changes warrant cognitive testing or specialist referral. Do not treat personality change alone as a diagnosis. Takeaway: sustained unusual personality shifts in midlife can be an early signal worth medical attention, because research and clinical experience link some of these changes to higher dementia risk years later. Okay, guys, here's the second half of the presentation for today for A. The page is a practical, caregiver focused guide that lists 7 early personality and behavior changes often seen in people with dementia, and explains what to do if you notice them. It frames these signs as observable shifts from a person's usual baseline and pairs each sign with a short example. And the author also outlines next clinical steps and common non-dementia causes to consider. The 7 first signs explained what the page describes. Reduced sensitivity to others' feelings. The person becomes less empathetic or emotionally responsive than they used to. The page gives a vignette of someone who no longer reacts to a friend's distress, apparently appearing cold and unfeeling. Formerly warm people may stop offering congratulations or comforts. Creating the impression they've become distant, lack of social awareness, failing to pick up social cues, dominating conversations or causing discomfort at gatherings, making inappropriate jokes, humor that crosses previously understood boundaries or becomes socially misplaced, loss of tact, blunt or harmful remarks that contrast with the person's prior sensitivity. Withdrawal and empathy and apathy, reduced interest in hobbies, social events, or activities the person once enjoyed, language problems, difficulty finding words or understanding complex sentences, which can accompany personality shifts. What the page recommends doing. See a primary care doctor first for an initial assessment and basic cognitive testing. Expect possible referral to a neurologist for deeper evaluation and brain imaging, MRI, CT, if dementia is suspected. Consider geriatrician involvement for comprehensive care planning and coordination with other specialists. Address legal and financial planning early. Power of attorney. Long-term care discussions and seek support groups and Alzheimer's organization for caregiving resources. Important caution on the page highlights not every change equals dementia. The article lists common mimics to rule out first: normal aging, stress or anxiety, medication side effects or depression, and medical problems such as thyroid disease or vitamin deficiencies. Evaluation to identify reversible causes. Practical, immediate steps you can take. How to act now. Document specific examples. What changed, when it started, and concrete incidents, dates, quotes, situations. Bring documentation to the primary care visit and mention family history or medication changes. Note red flags for urgent evaluation. Sudden severe confusion, rapid functional decline, or signs of delirium, fluctuating alertness, which needs prompt medical attention. Sustained unexplained shifts in empathy, social awareness, tact, mood, withdrawal, humor, or language in midlife or later are worth medical evaluation because they can be early indicators for dementia, but may also reflect treatable conditions. Okay, dementia questions. Dementia is a term that is used to describe severe decline in a person's mental ability. The decline may be so severe that it interferes with the person's day-to-day life. One of its symptoms would be memory loss. Dementia may have a wide range of symptoms, like problems with communication, difficulty in focusing on something and paying attention, lack of judgment and reasoning, etc. The condition may be caused because of damage to brain cells which interfere with the ability of these cells to communicate with each other. People may have many questions about dementia and its treatment. Given below are some of the commonly asked questions that have been answered by different experts. Is dementia a hereditary condition? These are 4 kinds of dementia that are hereditary. They are familial Alzheimer's dementia, frontotemporal dementia, which is linked to chromosome 17, familial prion disease dementia, Huntington's dementia. How long does it take for dementia to move from one stage to the other? There may be no specific timeline for dementia to move from one stage to the other. It may depend on how fast the condition progresses. It may progress slowly in some cases and very fast in some others. Many researchers believe that the patient's overall health and genetics may have a role in the progression of the disease or condition. Is there anything that can be done to slow down the progress of dementia? Medication and supplements may be helpful in slowing down the progress of dementia. In later stages, a medicine called Namenda may be useful in slowing down the progress Besides this, mild activity like walking may be helpful. Solving puzzles like crosswords, Sudoku, or trivia games may slow down the progress of the disease. Would propanol be useful in treating dementia? Propanol is a beta blocker that is usually used in controlling high blood pressure and performance anxiety. It may not be useful in treating or controlling dementia. What would be the prognosis of dementia in an 85-year-old woman? The prognosis of dementia in an 85-year-old woman may be very good. It may worsen progressively and cognition, orientation, speech, memory, recall may slowly decline. This will make the woman dependent on caregivers, even for the basic day-to-day activities. What is frontal lobe dementia? Frontal lobe dementia is a kind of dementia that is caused because of mutations in several different types of genes. Though there may be genetic components to the condition, most people who suffer from it don't have a family history. Frontal lobe dementia affects the part of the brain that controls the individual's personality. The condition may be treated with the help of antidepressants and antipsychotic medications, and therapy can Ritalin be used to treat frontotemporal dementia. There may be no permanent cure for frontotemporal dementia, though Ritalin may not be able to cure dementia. It may be useful in improving cognitive performance in some cases. Can Quinteplin be used to treat dementia? Quinteplin may be commonly used to treat paranoia, aggression, and sleep disorders. In dementia patients, the dosage may range from 25 milligram per day to 400 per day. The dose may be increased gradually whenever required. There are certain precautions that one may have to take if the dosage of the medication needs to be increased. Most doctors would advise increasing the nighttime dosage. The medicine may be given as twice a day doses, though in some cases the patient may be advised to take it 3 times a day. The patient may also have to be taken for an ECG, electrocardiogram, if if the dose needs to be increased. Canzopicolone be used to treat sleep disorders in dementia patients. So picolone may not be useful in treating sleep disorders in dementia patients in the long term. This is because the body may get used to the medication and it may not be effective as it was initially. The patient may try other techniques besides medicines as well to treat sleep problems like no visual or audio stimulation at bedtime and reduction in coffee or other stimulating drinks. Dementia can be very difficult to handle as it progresses. Dealing with patients who have these conditions will require a lot of patience on your end. You also need to know the various symptoms of the condition and the medications that may also help to control these symptoms. Sometimes giving the wrong medications may also aggravate the symptoms or create other complications. There is so much information about dementia on the internet that I can confuse you, or if you try to understand the condition on your own, the information that you read over the internet may also leave you with many questions like, how can the symptoms of dementia be controlled? Can it be cured? How can it be treated? Etc. You may speak to an expert at such times and get all your questions about dementia and its treatment answered. Okay, guys, that's A for you. I will be back on with B shortly. I'm going to take a little break and then I'll be back on with B for y'all. So for now, Gator Wellness Take care, folks.